Hello, I'm Dr. Chaiva from GCPT Medical Center. It's October and that means Breast Cancer Awareness Month. I'm going to be talking to you about self-breast examination or SBE. We'll talk about what it is, how often it should be done, why it's important, and how actually one can do it. So self-breast examination is a technique in which an individual can assess his or her breast tissue for any physical or visual changes. This is important because it allows one to familiarize with how their breasts look, feel, so that they can be able to pick up any changes and report them to their doctor sooner rather than later. SBE should be done once every month. So for menstruating females, for women who are still going on their monthly periods, they can choose a day about 5 to 7 days after their menses, which is around mid-cycle. This is the time when your breasts are less tender and less swollen, and you'll be able to palpate for any changes easily. For women who are postmenopausal or for women who have irregular periods, you can choose one day from the calendar. So for example, you can say the first of every month I'll examine my breast and then just get over and done with it. So now we're going to talk about how it's actually done. It's not a daunting task, I'll assure you. I use what I call the LTS technique: look, touch, and squeeze. So when looking, you're looking for any changes within your breast. So ideally you're supposed to go in front of a mirror and remove your clothes. With your arms raised above your head, look for symmetry. Assess for symmetry in both your breasts. Assess for any skin changes. Is there redness? Is there ulcers? Is there dimpling? Is there puckering? Assess the nipples as well. Are they inverted? Are they in the correct position? And do they have any discharge? If you notice any of these changes which I've outlined above, you should go and report them to your doctor. Also assess to see if the skin is not starting to look like an orange peel. This is an indication of a more serious condition. So you can either look with your arms raised above your head or with your arms placed on your hips and you flex your chest muscles. This way you'll be able to accentuate any masses or any lumps within the breast tissue. So again, arms above your head or arms on the side of your hips, flexing your chest muscles. So after you're done looking, you go on to touching, or what we call palpation. Basically what you're doing, you're using your right hand to examine your left breast and vice versa. You use the palmar surface of your 3 middle fingers, pressed together like this. So this is the part which you use. Lying down, you place your left hand on the forehead or at the back of your head, and you use the palmar surface of the opposite hand to palpate the breast tissue. So what you're aiming for is the area below the clavicle to just on top of your abdomen or just below the bra line. I'll use this balloon as an example of your breast. So what you do, you divide your breast into 4 quadrants. So say this is the left breast, and you take your right hand and you've divided the breast along the nipple line into 4 quadrants. Start in circular motion from the upper outer quadrant in gentle motion and move to the inner quadrants and then go to the lower quadrant. So you start with a gentle press in all quadrants and then you move on to a deeper press in all the quadrants. You also have to go into the axilla, so into the armpit, because breast tissue also goes into the armpit. So you have to palpate for any changes within the axilla. Also within the armpit, that's where you find your lymph nodes. So it's important for you to palpate the lymph nodes to see if they're swollen or if they're painful or if they're tender. If you notice any of these changes, you have to go and see your doctor. Some women might have lumps, but they might not necessarily be cancerous, but it's good to, if you've picked up a lump, to go and have it examined by your doctor. So don't forget, from the upper part just below the clavicle to just below the bra line, and you palpate all of the 4 quadrants. So you can do in circular motion or you can do vertically in strokes like this, but what you have to do is to cover all quadrants from the armpit up to the cleavage, and from the below the clavicle or the collarbone to just below the bra line. And after you've finished palpating with the left breast, you move on to the right breast and you repeat the same movements which I've demonstrated for the left breast. After you've done this touching or palpating, the last thing is squeeze. What you're doing, you're just taking your hands and you squeeze the breast tissue so that you can squeeze out any fluid or any discharge. So if there's blood, if there's a watery discharge, if there is something that looks like pus, any discharge which is not breast milk and you're not breastfeeding and you don't understand what it is, you need to go and see your doctor. So basically, this is SPA. So once every month, mid-cycle for women who are still going on their monthly periods, any day of the month for postmenopausal women or women who have irregular cycles. Everyone should be able to do the LTS, look, touch, and squeeze. If you have any questions or you want to know more about self-breast examination or anything breast cancer related, feel free to come through to Chisipiti Medical and Dental Center and we'll be happy to help you. Good day.